Hey guys, welcome to Nightmare on Struggle Street. We're going to go for a drive to Struggle Street and we're going to talk about people losing their health insurance, which is a pretty major thing in the United States of America. So strap on in, enjoy the ride and the scenery, and I'll see you in a second. Okay, we're on the road, and please, that weird noise is just my plug-in hybrid car in full electric vehicle mode. So let's talk about something that's honestly ridiculous. Hundreds of thousands, if not millions of people in America are losing their health insurance. Not because they did anything wrong, and also not because they suddenly got rich, but because of bureaucracy and greed. Yep, you heard that right. The US healthcare system's struck again. In the so-called richest country on earth, millions of Americans are losing something most of the world takes for granted, which is healthcare. Every year, more and more people are being priced out. They're being dropped from coverage or left uninsured after losing a job. And with rising costs, expiring pandemic protections, and insurance companies paying for less and less and tightening their belts, the situation is only going to get worse. You would think this shouldn't happen, right? Especially right after the pandemic, when you'd think we've finally learned how important healthcare is. Well, guess what? I guess no one learned how important it was. So here's the deal by the numbers. Right now, around 25 million Americans don't have health insurance, and that number is going up yet again. During the pandemic, the government basically said, well, hey, we'll keep you covered through Medicaid. No questions asked. It was one of the few good things to come out of that mess. But when the pandemic ended, states started reviewing, and that's in quotes, who still qualifies, which sounds fine until you realize they're cutting people off for things like missing a letter in the mail or forgetting to upload a document. During the pandemic, also, temporary federal programs kept millions covered through Medicaid expansions and emergency measures. Those protections have since expired, and states have been purging Medicaid rolls, cutting off coverage for children, seniors, and needy working families. I saw a news clip the other day, and the news anchor was saying over 10 million people have lost Medicaid coverage since the public health emergency ended. You know what? That is a really disturbing number. And you know what? It's not just a number. That's 10 million living, breathing people in this country who now have to choose between rent, groceries, or a trip to the doctor. There are a few reasons this is happening, and none of them really make any sense. The first reason is Medicaid reviews, or what they call redeterminations. Basically, if you don't jump through the exact right hoops, you're out, even if you're still technically eligible. Second reason is job-based insurance is fading away. I think in the next 10 years, it's going to be a thing of the past. More people work gig jobs, part-time or contract positions, and those rarely come with benefits. If you lose your job, you also lose your health insurance. You're screwed. And thirdly, even if you do have insurance, good luck affording it. The average family plan now costs over $25,000 a year. That's like buying a small car every single year. And that's just to maybe go to the doctor. How many families do you know who can afford that? And that's just for the premiums. On average, a 50-year-old male will pay around $1,350 a month for a HMO managed care plan with a $4,000 deductible and $40 copays for office visits, etc. It's not exactly health coverage if you can't actually afford to use it, is it? If you want the blue ribbon of health insurance and opt for a PPO plan, oh my God, you will get some bills that will send you right back to the emergency room with heart palpitations. And these days, even with employer coverage, deductibles and copays are at record highs. So let's make this real for a second. I read about this mom in Texas who lost her kid's coverage because she missed turning in one form. Now, nobody called her and asked her to send it in. No one texted her, no email reminder. They just cut her off. And there was this guy in Ohio who's skipping his heart meds because his deductible reset. And he just hasn't got any more money this year. A gig worker in California who makes too much for Medicaid but not enough for Marketplace, also known as Obamacare insurance. And these aren't rare stories. This is what's happening everywhere, every day, all across America. People are stuck between too poor to afford healthcare and too rich to qualify for help. They're right in the middle there. Missing medications or not seeing a doctor when you really need to, because it's either med/doctor or food/rent, that's just not acceptable. No one should have to make that choice in a so-called first world country. We really shouldn't. And meanwhile, the health insurance companies, they made $69 billion in profit last year. Not 69 million, 69 billion in profit. And some of those CEOs earn $100 million a year. Let that sink in. You know what? If nothing changes, this problem's only going to get so much worse. States are cutting Medicaid rolls, premiums keep going up, employers are now pushing more of the cost onto employees, and that's if they even still offer health insurance as a benefit. It's like the safety net has a giant hole in the middle, and most people don't realize it until they fall through. Healthcare in America has basically become a luxury item. You can't afford to be sick, but you also can't afford to be well. So yeah, Americans are losing health insurance again, and no one in charge seems all that concerned. Keep in mind those in charge, on both sides of the aisle, have excellent healthcare, courtesy of Mr. and Ms. USA taxpayer. They're given special health insurance, not available to us masses. I'd love to see Congress and the Senate pay for out of their own pocket an Obamacare plan, and then watch their eyes pop out of their sockets when they get a bill for a specialist visit and 2 days in hospital in the mail. As usual, politicians are completely disconnected from the real world and the struggles of Americans. Healthcare isn't just a policy issue, it's a survival issue. It's critical that we have healthcare. But here's the question: how long can we keep pretending the system works before it completely collapses? And I think if you've ever had to fight with your insurance company, or you're paying off medical debt right now or in the past, you already know the answer to that one. Anyway, guys, that's it for today. Stay healthy, or at least try to afford to. Go ahead and hit subscribe if you want more videos about what's really going on out there.